Okay, now I'm going to show you kind of what a drug that is not like saline or ringers or anything is, what it looks like on the screen when it's running simultaneously with, we'll just call it saline, with our saline. Channel select, this is channel B, tells you right up here, channel B. Oh, here. We're going to hit don't want that one, sorry. Hit channel B, we're going to hit, I'm going to say we are running Cipro, which is an antibiotic. It's one of the more common ones that we run through. You're like Cipro, ciprofloxacin, what's that? Okay, that is in the guardrails, under guardrails, ciprofloxacin. They have these nice little cheat sheets here, is Cipro, which you shouldn't have to worry about. It should be set up, it should be running when you pick the patient up at the ambulatory care center. Ciprofloxacin, we'll pick a concentration that they use. And this is just, they're going to have this set up, so you're not going to have to worry about it. I just want you to see what it looks like when it's running through and what you'll have. And this goes with even your nitro, your heparin. So they have nitro, heparin, and an antibiotic running. So you're going to have 3 drugs running off of your channels, plus you're going to have your saline running. So you're going to have 4 channels set up here. And it kicked me out. Go figure. Okay, I'm just going to start it running here. Okay, your Cipro's running, and you're leaving the care center. You're getting the IV fluid bolus off of your saline, so you have 2 channels operating. Your Cipro, it tells you, ciprofloxacin, which is the Cipro, because that's what the nurses told you. It's 200 milligram, and it's in a 100 ml bag. It's running. When it's finished, this is going to start beeping. It's going to have green lights flashing, and it's going to tell you that the infusion is complete. You don't need to do anything with it. It'll turn off by itself, or it'll knock it down to just to keep open rate at like 20 ml an hour. You're not going to have to do anything with this. Your IV fluids, your saline, are going to keep running at 999 ml an hour, which is your IV bolus. You have, this is for an antibiotic. Say you have nitro running. It's going to tell you across here, and we can switch this over so you can see what the nitro will look like. I'm going way over my 30 minutes here. Turn this channel off. Just show you real quick what nitro would look like. Oops. There's your nitroglycerin. We would hit that. Tells you the amount, 50 milligram and 250. We'll hit that. It'll ask you if it's correct. You're not going to have to worry about setting any of this up. I just want you to see what it looks like. Say they want it running at 5 mics. 5 mics is 3 cc's, 3 mil an hour, except on this one. Our rate, we'll hit at 50. Okay, this is your nitro that's running. If it would happen, your nitro, your heparin, any of those would start beeping that they're included. If they have air in the line, you would need to disconnect that from your IV, and it would be connected in to your saline with an alligator clip. So your nitro, just say it starts beeping air in the line. Disconnect it, pause, open it up, run your fluids through till you don't see any air. Connect it back in. Hit restart. It's going to check, and it's going to start running at 10 mics a minute. And there you go. That's the quick in service on the IV pumps. We do have some questions here. What was your question that you...
My original one was, say you had like a medication with the
Oh, and you flow it through. Okay, the one question I have right here is, say you had Cipro running, you had air in the line, you pause the infusion, disconnect it from the patient, take it out of your channel, and you run it through to get rid of the air bubble. This line probably holds about 10 mil of the medication. 10 mil isn't a big deal to lose of the medication, but say you're running it through and you end up running about half the bag. Make sure you tell the nurse at the other end at the hospital that you had a problem with your IV setup. It kept beeping, kept saying air in the line, and you had to run fluid through the line to get rid of the air bubbles, and you wasted about 50 mil of the IV fluid here. That would be important. 10 mil I don't think would be that important. You see this here, it says occluded patient side. I forgot to open up my roller clamp. Now I hit start, and there we go. We're running again. But I mean, if you would waste a lot, 50, 100 mil of whatever IV fluid, make sure you tell the nurse on the other end, wherever you're delivering the patient to, because that would make a difference in the medication they were getting. Things to remember: never stop your nitro, heparin, cardizem, dopamine, any of those. Never just stop those IV infusions because your IV pump's beeping at you. Always try to troubleshoot and try to get the problem corrected. Remember, no boluses. I mean, especially with any of your heart medications, take it off. Take the IV fluids off the patient, okay? Disconnect whatever one you're having problems with. Get the problem fixed, reconnect, and restart it.